Hi, good morning, friends. I hope you all are healthy, fit, safe, and doing well at home. Today's talk is more for parents. Friends, we all know that cough is a very common symptom. In fact, 70 to 80% of children in our OPD present as a cough. No one can say whether it is adult or children that he did not cough. So you can imagine how prevalent it is. Today I am going to talk about what is cough, why do we cough, what are different types of cough, and when do we need to go to a doctor for cough, and when do we need not go to a doctor for a cough, and what we should tell the doctor about cough, and certain tips about home remedies, especially non-medicinal cough remedies. So friends, what is cough? Cough is a protective reflex. Mother Nature has gifted that to us. Something like withdrawal reflex. Like if we touch something which is hot, we immediately remove our hands from the harm. So cough is also a protective reflex. Why do we cough? When something undesired, unwanted enters our airway, and our airway starts right from here, nose, something which is behind the nose, it is called nasopharynx. Then air enters into our oral cavity of the mouth, it is called oropharynx. Then it enters into our throat, what is called trachea or the air pipe. And then it branches out into different terminal airways, first order, second order bronchi, and the terminal airways. As it goes down, the airway becomes more and more narrow. So right from tip of the nose here, the nasal openings to the terminal airways, if there is anything which is unwanted, it could be in form of some atmospheric irritants which unknowingly we inhale, or it could be some bacteria, fungus, virus, or perhaps some food particles or food drinks which we ingest or inhale or aspirate, that can cause cough. Now the lungs, our body realizes that they are unwanted element, so the brain directs our lung to have a forceful expiration of expulsion of air, so that unwanted thing, it could be tiny secretions, some secretions also, they are being taken out from the system. So this is the reason why do we cough. So it is a protective reflex. We need to understand cough is not bad. It helps our body in clearing our airways. On the contrary, no cough, less cough, zero cough is bad. It is dangerous, especially if you are semi-conscious, drowsy, or unconscious. Then your body will not be able to cough, and you may choke yourself. Now, what are different types of cough? That we need to understand. And how the parents can understand cough. Cough, as a parent, you should know that cough is to be assessed on 3 parameters. One is frequency of cough, 2, duration of cough, and 3rd is character or the sound or the pitch associated with the cough. Now the frequency of cough is like a mother can tell that child is coughing, let's say every 30 minutes or maybe every 6 hours or twice or thrice a day. That is frequency. Number 2 is duration of cough. Like this duration of cough just maybe 2 seconds, and this one so maybe around 6 to 8 seconds. As a parent, please let your doctor know this duration of cough and frequency of cough. Now, third important thing, which is perhaps most vital, which will help the doctor in management of your cough, is the character of the cough. I have few recordings of the character of the cough, sound of the cough, which will perhaps help you understand to categorize different kind of cough. Have a listen. you must have noticed that this pitch of the cough is not kind of a moist. There's no added sound. It's simply a coughing sound. So this cough is called dry cough. And dry cough, which is the most common type of cough. It's a benign cough. You should not worry at all. Even if child is coughing 10 to 12 times or 20 times in a day, and the duration of the cough is small. Child doesn't cough continuously for 20 to 30 seconds perhaps. It could be just 10 to 12 seconds. Most of the dry cough is because of the common cold or viral infection. And this viral infection cough happens it happens more in the night time. When the child lies down, the secretions from the nose goes back, hits our nasopharynx, that is the airway which is present in the nose or in the oral cavity. And those secretions are sensed by cough receptors as an unwanted thing. So the brain signals the body to clear those secretions. That's why they go into a cough. So the dry cough, if it happens more in the night, it is due to cold and cough. Or it happens more in the daytime. It could be very well be without cold, some irritation in the throat, some inflammation due to viral infection in the throat. That's why dry cough is coming. So this is a typical sound of the cough. Short duration, doesn't bother patient too much. Patient is generally looking well. So that's the dry cough character. Now I want you to listen to a second category of cough. Now if you have noticed the difference between first category and second category is a moist cough. The sound of the cough, you can feel as if some additional sound is there, as if your chest is rattling. There's some phlegm in that. Phlegm, what we call in common terms, in our medical terms, we call it, there is some mucopurulent or mucoid discharge, which is partially blocking the airways. Now, it becomes more relevant in a smaller child, less than 6 months or perhaps less than 1 year, because the caliber of their airways is very small. So even 1 to 2 grams of cough can block their airways. And the baby tries to cough to dislodge their airway. He keeps on coughing until he throws it up, or as a vomiting, or he can ingest. So the moist cough, again, will not be of longer duration, but it will be more frequent. Maybe every 1 to 2 hours child is coughing, and the sound of the cough will be different. It has a moist character, phlegmy character. So that's how you differentiate dry cough from the moist cough. Now, one of my patient had third category of cough, which I want you to listen. Now, if you have noticed, in this sound bite, a baby is coughing continuously, and then his perhaps lungs are getting drained out of air, so he wants to take a quick gasp of air to refill. So he's coughing. So that's called a whooping cough. Whoop is a typical sound produced due to sudden inhalation of air that vibrates our voice box. So that is called whooping cough. It's not that common nowadays thanks to the DPT immunization, because commonest reason for whooping cough way back 20-30 years before was bacteria called pertussis. But nowadays we are not seeing frank pertussis. It does happen. It's not extremely rare. It can happen, but it's not so common. So I don't want to go into the medical or technical part. What I want you to understand is this third category of whooping cough, the frequency of cough will be more. It will be more frequent than dry cough and moist cough. Duration of cough will be prolonged, but the difference is it is not moist. It is kind of dry cough, but it will be continuous, like a staccato, like a paroxysm of cough. And since we cough only when we exhale, so baby exhales continuously, then he wants air, he wants oxygen, so he suddenly takes a lot of air inside. That is the reason for the typical whoop kind of cough. And sometimes, especially small babies, newborns or less than 6 months of babies, they suddenly go into arrest also, breathing arrest, because they are so drained out, their muscles are fatigued and tired, they keep on coughing, and then suddenly they stop breathing also. So parents, if you hear a continuous coughing followed by a whoop kind of sound, that's a danger sign. Don't stay at home. Please go to a doctor. Now the fourth category of cough, I want you to listen. Alright. Okay. Now, in this cough also, the pitch, the character of the sound of the cough, if you have noticed carefully, it's a bit hollow. It's kind of a brassy cough. We call it a croup or viral cough. Now, the duration of cough will be less in croupy cough as compared to the whooping cough. In whooping cough, the duration of cough will be more. So the more the lungs are exhausted of the air, more prolonged is the inspiration. So the whoop sound will be more sustained, more prolonged. Whereas in croupy cough, fourth category of cough, child will cough, but the whoop sound, the croupy sound will be of lesser duration as compared to the whoop sound in the whooping cough. So this is the fourth category of croupy cough. This is common, more common than the whooping cough. Most of the time seen in the flu season from September to March in Dubai, and it's most likely due to viral infection. The point of concern, point of worry is it causes inflammation of the voice box, and sometimes the inflammation makes the voice box, the anatomical structure there, swollen. Once they get swollen, they block the internal diameter of the airways. I told you earlier the diameters of the airways are small. So that's where child has breathing difficulty. Parents can notice this, that child will have breathing difficulty in croupy cough, and they will hear typical whooping, typical croupy sound. So they will cough, and another point to be noticed is they will have one dip here, what is called stridor. They will cough. So if you notice here, this part of the neck, it is dipping inside. That's the time when you should be careful and you should go to a doctor. Added to that is another category of cough which is quite common, what is called habit cough or vocal tic, where this is more seen in adult or older child, or perhaps adults also, where there's a throat clearing. It becomes a habit, like so this is again a benign thing. They feel something is irritating the throat, maybe some secretions, so they have a glass of water and throat gets cleared and cough gets stopped. This is a habit cough, and invariably it becomes a part of habit also in older child. So older child, mother says that child is coughing maybe 30 times in a day, but the difference is the duration of cough. Duration of cough will not be more. Frequency will be more, but duration will be less. And the character of the sound of the cough will be dry cough. This is typical habit cough. And sometimes it can last for even weeks or months also. There's no need to have any treatment for that. So having differentiated different types of cough, the best way is, nowadays we are lucky that we are living in a technologically revolutionized world. We all have smartphone at home. So I would suggest that parents please take a video recording of the cough, its frequency, its duration and character. It will help in the doctor in management of the cough if he listens to the sound of the cough, because Many of the parents may not be able to describe the character of the cough properly. So please make use of the technology in recording the type of the cough. Now dry cough, habit cough, no need to panic, don't worry at all. Most of these cough are self-limiting. They have very short shelf life, sometimes 3 days, sometimes 5 to 7 days, because they are a viral infection. So please don't press or pressurize your doctor to write cough syrup. And don't pressurize to write antibiotic, because most of these first category of cough go on their own. And I know this sound of the cough is disturbing, disruptive, it creates a lot of anxiety, especially if the child is coughing in the night. Parents have to go for office tomorrow, so the family dynamics gets disturbed. But this level of disturbance is nothing as compared to harmful effect due to some of the ingredients, especially antihistamines, which are there in the cough syrup. Now, cough syrups in less than 2 years of child, especially the child who has dry, benign kind of cough, should never be given. Never be given. In fact, USFD has clearly warned that they have banned the sales of these antihistamine containing cough syrup in children less than 2 years of age. Why? Because these ingredients, antihistamines, can cause a lot of dryness, drowsiness, and sometimes a lot of excessive sleepiness. Sometimes they can have vomiting. So they have dangerous side effect on one hand, on second hand they are not useful. So there's no point in giving. But when parents persistently ask the doctor to give cough syrup, that's when the trouble starts. So that's the purpose of this video. Please understand, I'm counseling you. Small common type of cough, no need of cough syrup. Then what to do? What we can do, perhaps some adjunct therapy, what is called non-medicinal cough remedies, which you can do it at home. You can give him ginger water, you can give him honey with water, but not below 1 year of age. Honey should be given after 1 year of age. So ginger, warm water, tamarind or honey, or you can give humidified warm air, or you can give some normal saline spray in the nose, because if there's a common cold, the secretions will hit the back portion of the nose and throat to reduce those secretions. Sometimes this body water helps. So these are the non-medicinal therapy. But if you have a moist cough, whooping cough and croupy cough, you should visit the doctor. Let the doctor decide what needs to be done. Now again, in this kind of cough, I'm sure most of us, we pediatricians, would like to treat the cause of the cough rather than suppressing the cough. There are some medicines in the ingredients in the cough which can suppress the cough. But cough suppression is more dangerous. We want to help the child in taking out the cough. So those are the technical details the doctor will decide. And there are certain conditions where you need to give cough syrup. But by and large, most of the children who have cough do not require cough syrup. But we as a doctor expect from the parents to have loads and loads of patients. And please don't pressurize doctor to write antibiotic. This cough is a protective reflex. It will go on its own. Lastly, a word of caution, I must say, there's a special category of cough which starts suddenly like a snap. When child is having any food, or he's drinking water, or perhaps he's playing with certain objects, especially toddler age group, 1 to 3 years of age. Maybe nuts, peanuts, coins, balloons. That thing gets stuck up in the airway, and he chokes. If it is a tiny object, an older child, that means here airway's caliber is big, tiny object, it will go into the lower portion of the airway, what is called lower breathing airways. It will not cause immediate lethal or dangerous problem, but child will have sudden onset of cough. So there you should tell this history and visit emergency room or visit your doctor. Sometimes a child is small, airways are small, but he inhales, he takes into his airways larger object. Could be part of the grapes or nuts that lodges and blocks our main airway. This is extremely dangerous. This is something called choking hazard. So I'll be talking about this choking hazard and cough due to the tiny particles, foreign bodies in the airways, and choking hazard in my next video. What you should be careful of and what to do, because ambulance will take time to come. There are certain things you have to do. You have to do at home if there is a choking hazard. So friends, the take home message is, don't worry. Don't give cough syrup. Record your cough of your child in a video clip. Show to a doctor. And of course, no cough syrup. Please remember, have lots of patience, have trust in your doctor. Thank you very much. I hope you like this video and some tips I have given. Most of the my uploads on my channel would be talking about prevention. Treatment part is of course for the doctors, but if you are able to prevent, child will not fall sick. That's the whole purpose. Feel free to share the video, and if you have any questions or comments,